When you picture ancient surgery, you probably imagine crude knives, superstition, and desperate guesswork, a world before real medicine. But here is the truth. Roman surgeons were using instruments so precise, so specialized, that many would look familiar in a modern operating room. Scalpels with replaceable blades, forceps designed for delicate extraction, probes, catheters, even mechanical speculums built from bronze, entire surgical kits buried for 2,000 years, waiting to prove that Rome was not practicing primitive butchery, but a form of advanced medical engineering. And the most shocking part is this. These tools were not rare experiments. They were widespread enough to fill collections with hundreds of instruments, shaping the foundations of surgery long before anesthesia or antibiotics existed. So what did Roman surgeons really have in their hands, and how much of modern medicine began there? Stay until the end, because the final tool might change how you see ancient history forever. Let's get into it. Roman medicine was not just herbs and prayers. It was a practical response to an empire built on war, labor, and constant injury. Fractures, dislocations, wounds, and disease demanded real solutions. Surgeons became essential figures in Roman life, treating soldiers on campaign, workers in cities, and citizens in public spaces. The surprising reality is that surgery was already highly organized. Procedures for broken skulls, shattered limbs, and even amputations were described with careful detail. This was not chaos. It was structured medical knowledge paired with specialized equipment. The roots of Roman surgery actually reached back to Greece. Rome conquered the Greek world militarily, but in medicine, the conquerors became the students. Greek surgical knowledge flowed into Roman practice, and for centuries the two traditions were nearly inseparable. Physicians like Hippocrates and later Celsus and Galen laid down written accounts of operations that Roman surgeons followed and refined across generations. What made Roman surgery remarkable was not just that it existed, but how far it reached. Skull fractures were treated with trephines to relieve pressure on the brain. A special instrument called the meningophylax was used to shield exposed brain tissue during the operation. Fractured jaws were stabilized using ligatures of gold wire or flaxen thread tied to adjacent teeth. Broken collarbones were treated with wool pads and bandaging techniques that barely differ from what modern doctors would recognize. For the long bones of the arms and legs, surgeons restored alignment through careful extension and counter-extension. Bandages were layered with serrate to harden them in place, an early version of the cast. Specific positioning mattered too. A broken forearm had to be set with the thumb higher than the fingers and the little finger lowest, matching conclusions that modern orthopedics would reach centuries later. Even amputation was practiced, though surgeons approached it with extreme caution. When gangrene or cancer left no other option, the operation was performed swiftly and decisively, but the risks were so severe that most surgeons reserved it as a last resort. This was not primitive guesswork. It was deliberate, recorded, and repeatable. Rome needed surgery to survive, and that necessity drove the development of advanced medical practice. One of the most astonishing windows into Roman surgery came from a place frozen in disaster. In Pompeii, a surgeon's house was uncovered with dozens of instruments still inside. Not one or two tools, but an entire professional kit. Probes, scalpels, hooks, and forceps. Objects designed for specific tasks, not improvisation. This discovery matters because it proves these instruments were not theoretical. They were used in daily practice. Real surgeons, treating real patients, in a world we often underestimate. And Pompeii was only the beginning. Other collections from Roman cities preserved nearly 200 inerrant surgical instruments, showing just how widespread this technology had become. The house stood along the Via Consularis, one of Pompeii's main roads. When archaeologists cleared the volcanic debris, they found 40 surgical instruments in a single residence. Among them was the speculum, a probe concave on one side and flat on the other, exactly matching descriptions left by the Roman medical writer Celsus. There was the scalper excisorius, shaped like a lancet point on one end and a small mallet on the other. Hooks and forceps designed for obstetrical work were also recovered, and contemporary scholars noted that these instruments equaled the best E-noughts of modern cutlers in both convenience and ingenuity of construction. The Royal Bourbon Museum in Naples eventually gathered the full haul from both Pompeii and Herculaneum. The total reached 199 distinct instruments. The range was extraordinary. Speculums, forceps of many types, dozens of probes, a catheter, a silver lancet with an engraved bronze handle, cupping instruments, and a lever designed for repositioning fractured bones. Even a small bronze spoon used for examining blood drawn from a vein was among the collection. This was not one physician's eccentric hobby, it was the standard equipment of a profession. Archaeology reveals Roman surgeons worked with full medical toolkits, not primitive blades. The Roman scalpel was already here. The scalpel feels like the symbol of modern surgery. Sharp, precise, controlled. But Roman surgeons already had it. Some were made with iron-cutting edges, others fitted into bronze handles. The design was practical and durable, built for repeated use. A scalpel was not a simple knife. It was a specialized surgical instrument, shaped for incision with control. That level of refinement tells us something important. Roman surgery was not random, it demanded precision. The most complete evidence for this comes from a surgeon's house discovered in Rimini, Italy. The building was destroyed around 260 AD during a sudden raid by Germanic warriors. The violence of the attack and the fire that followed collapsed the structure so quickly that the physician inside never recovered his equipment. When archaeologists uncovered the ruins, they found roughly 150 surgical instruments preserved exactly where they had been stored and used. It is the richest Roman medical toolkit ever discovered, surpassing even the famous collections from Pompeii. Among the instruments were more than 30 intact scalpels, each still retaining its bronze handle and iron blade. 10 additional handles and several isolated blades were also recovered. What stands out is the sheer variety. Blade shapes ranged from broad and leaf-shaped to narrow and curved, each designed for a dinarant type of cut. Some blades curved longitudinally in a way that matched ancient descriptions of knives used in tonsillectomy. Others had double-edged blades that were concave on one side and convex on the other, corresponding to instructions left by the physician Galen for delicate dissection of the chest. One particularly striking scalpel featured a myrtle leaf-shaped blade mounted in an octagonal bronze grip, with a slender olivary tip at the opposite end. Its blade was strong enough and thick enough to open the vertebral canal, matching Galen's description of an instrument he claimed to have invented himself. One that had to be forged from the finest steel so it would not bend or break under pressure. The surgeon who owned these tools clearly understood that different operations demanded different blades. His collection was not accumulated by chance. It was assembled with care, ensuring the right scalpel was always within reach for whatever case walked through the door. Holding one of these tools today is like seeing the outline of modern medicine emerging from antiquity. Roman scalpels show surgery was already a craft of precision, not crude cutting. Forceps are one of the most recognizable surgical tools today, used for gripping, extracting, and handling delicate tissue. Romans had them too, many kinds. Some for pulling teeth, others for removing bone fragments from deep wounds, some even designed with locking mechanisms that mirror modern surgical forceps. What makes this extraordinary is the craftsmanship. These were not simple tongs, they were engineered instruments created for specific medical challenges. In a world without imaging, without anesthesia, without antibiotics, Roman surgeons still relied on tools that demanded steady hands and advanced design. The Rimini collection alone contained 19 spring forceps in a range of sizes and jaw types. Others featured fine, accurately cut interlocking teeth that locked tissue firmly in place during an operation. Several included a sliding bronze ring that traveled along the arms to lock the jaws shut, allowing the surgeon to clamp a vessel or hold tissue without using both hands. This is the same basic principle behind locking forceps used in operating rooms today. One spring forceps was made entirely of iron, which is notably rare among surviving Roman examples. Nearly all others were crafted from bronze, following a tradition that stretched back to Hippocrates, who had prescribed bronze as the preferred metal for medical instruments centuries earlier. The choice was not arbitrary. Bronze resisted corrosion, held its shape under repeated stress, and could be cast and worked into fine, detailed forms that iron alone could not easily achieve. Beyond the spring type, The Rimini find included cross-legged forceps built for highly specialized work. The Staphylagra had hollow, finely toothed jaws designed to clamp a diseased uvula so the affected tissue would die on before the surgeon cut it away with a scalpel. This method deliberately avoided the dangerous hemorrhage that direct cutting would cause. A related instrument, the Staphylocastes, worked on the same principle, but with smooth-rimmed jaws that held caustic paste against the tissue to destroy it chemically. Both instruments were also recommended for treating hemorrhoids using the same clamping technique. Perhaps most impressive were 7 iron dental forceps recovered from a single cluster, each one dinered slightly in size and curvature, carefully graded so the surgeon could select the best match for every individual tooth and patient. Their gripping surfaces were precisely serrated to prevent slipping during extraction. No other Roman find has ever produced more than 2 dental forceps together, making this collection a striking testament to how thoroughly one practitioner prepared himself for the full range of cases he might encounter. Roman forceps reveal a sophisticated surgical toolkit built for delicate operations. Not every tool was dramatic. Some were quiet instruments of examination. Roman surgeons used bronze probes to explore wounds, locate foreign objects, and apply treatments. Dozens have been found, showing how essential they were. Even more surprising, Roman catheters existed. Curved bronze tubes designed for urinary treatment, nearly 10 inches long. These instruments remind us that Roman medicine was not only about cutting, it was about diagnosing, reaching inside the body carefully, and solving problems that required technical knowledge. Probes were arguably the most fundamental tools in the Roman surgeon's kit. In a world without any form of internal imaging, a physician had no way to understand what lay beneath the skin except by careful physical exploration. Before any operation could begin, the wound had to be fully characterized. Probes were the answer to that problem. They allowed the physician to map the depth, direction, and severity of an injury before ever picking up a blade. 45 bronze probes were recovered from the buried cities near Vesuvius alone. Most were double-ended and multifunctional. A probe could serve to examine a wound on one end and apply a medicament on the other. Ear scoops, another common find, were used to dislodge wax or foreign material from the ear canal, but also doubled as tools for applying liquid medicine. A piece of wool wrapped around the handle could be dipped into a solution and allowed to drip down the pointed end into the ear or even into the eyes. Others served for curetting small areas or measuring out doses of medicine. The spatula was equally versatile. Flat-bladed and smooth, it was primarily used for spreading ointments and salves onto wounds or for performing blunt dissection of tissue. Like the probe, it was a tool of care and preparation as much as treatment. The bronze catheter found at Pompeii is perhaps the most quietly remarkable of all these instruments. Its double curve was not accidental. It followed the natural anatomy of the male urinary tract, allowing the tube to be inserted with minimal resistance or injury. At roughly 10 inches in length and 3 lines in diameter, it was built for real clinical use, not display. From the Rimini find, further diagnostic and therapeutic tools emerged. A finely crafted iron instrument has been identified as a probable example of the scoop of Diocles, a device specifically engineered to reach into a wound and extract an embedded spearhead, a common battlefield injury that required extraordinary precision to treat without causing further damage. Roman probes and catheters show advanced medical care beyond surgery alone. There is one Roman instrument that consistently shocks modern audiences: the speculum. Bronze mechanical dilators existed in Roman medical practice, designed for gynecological and rectal examinations. Some operated with screw mechanisms, expanding with controlled force. This is not medieval. This is not modern. This is ancient Rome. The existence of such tools proves Roman surgeons were not simply treating wounds. They were developing instruments for internal medicine, examination, and specialized procedures that required engineering as much as anatomy. The largest surgical instrument recovered from the Vesuvian cities was a speculum made entirely of bronze. It was designed for gynecological use, though the word speculum, as we understand it today, does not quite capture what this device was. It was a dilator, a mechanical tool that could be opened gradually to allow the physician visual and physical access to internal structures. The ancient medical writer Paulus Aegineta left instructions for its use, directing that the operator hold the instrument steady while an assistant turned the screw so that the internal blades would separate and the vagina could be distended in a controlled manner. The division of labor between physician and assistant was itself a sign of how formalized these procedures had become. A rectal speculum was also found, again made of bronze. Its mechanism differed from the gynecological version. Instead of a screw, it relied on two handles that crossed at a central hinge. When the handles were brought together, the branches at the opposite end opened outward, dilating the area for examination or treatment. The design was mechanically simple but functionally precise, giving the surgeon control over exactly how much force was applied. What makes these instruments so striking is not just their existence but their engineering. These were not rough tools forced into service. They were purpose-built devices with moving parts, calibrated mechanisms, and ergonomic consideration. The screw-operated speculum required careful machining of its threaded components. The hinged rectal speculum needed balanced tension across its pivot point to open smoothly without causing injury. These instruments also tell us something about the scope of Roman medical practice. Surgeons were not limited to treating external injuries. They were conducting internal examinations, diagnosing conditions that could not be seen from outside the body, and performing procedures deep within anatomical spaces that demanded both courage and technical skill from the physician and extraordinary trust from the patient. Roman speculums demonstrate unexpected sophistication in internal medical practice. For all their engineering brilliance, these tools operated in a world that offered no safety net. No anesthesia, no antibiotics. Infection was a constant threat. Bleeding was terrifying. Hot irons were used to cauterize wounds. Pressure and styptics were common. Ligatures were sometimes known, but control of hemorrhage was uncertain. Yet even within these dangers, Roman surgeons pushed forward. Their instruments show a determination to master the body with technology, even when medicine was still fighting against nature itself. The fear of uncontrollable bleeding was probably the single greatest constraint on Roman surgery. It explains why amputation was so rare and why surgeons approached it with such visible reluctance. When gangrene or cancer made the operation unavoidable, a band was placed around the limb to retract the skin and guide the incision. The cut went straight down to the bone in a single circular sweep. Tendons were pulled back, the bone was scraped clean and sawn through, and then the moment of greatest danger arrived. If blood poured from the stump, red-hot irons were pressed against the open vessels. A double compress was laid over the wound. There was no room for hesitation. The ligature was not entirely unknown. Some surgeons tied own vessels during amputation, and ligatures were used routinely when excising varicose veins or removing a testicle by tying the spermatic cord. Aneurysms in the head and extremities were treated by placing a ligature on each side of the swelling, then opening the mass between them and clearing out the clotted blood. But for open wounds and sudden hemorrhage on the table, most surgeons still fell back on direct pressure, styptic powders, and the cautery as their primary defenses. Aneurysms of the carotid, axillary, and inguinal arteries were simply declared incurable and left alone. The Roman public was also deeply uneasy about placing their lives in the hands of another person rather than trusting an omnipotent God. Human dissection was widely opposed, which left surgeons working with an incomplete understanding of internal anatomy. A misdiagnosed condition or a botched operation could destroy not only the physician's career, but public confidence in the entire medical profession. This pressure made careful preoperative examination with probes and diagnostic tools not just useful, but essential for survival in the profession itself. Despite all of this, the Rimini surgeon's collection included a purpose-built cautery, a rare archaeological find. It featured a long, slender handle ending in a square heated head, designed to be applied with control to specific areas of tissue. Most cauterization, however, was performed with whatever instrument was at hand. Scalpels, needles, and probes were heated and repurposed when the moment demanded it. Roman surgery was advanced, but practiced in a world of extreme risk and survival. The greatest surprise is not that Romans had surgical tools, it is how familiar they are. Scalpels, forceps, probes, catheters, speculums. The foundation of surgery today already existed in bronze and iron 2,000 years ago. The Roman surgeon was not a barbaric cutter. He was a trained professional holding tools shaped by centuries of experimentation. The metals were chosen deliberately. The instruments were organized by specialty and stored in portable kits ready for emergencies. This was a professional whose workspace would be recognizable to any surgeon today. Modern medicine did not appear suddenly in the Renaissance. Its roots stretch back into the operating spaces of the ancient world. Rome built roads that still carry traffic, and surgical instruments whose basic forms still lie on sterile trays in hospitals around the world. If this changed how you see ancient Rome, let me know in the comments. Like and subscribe, but only if you like this video. Hope to see you in the next one.